Hey everyone, I'm Dan Dean. Living in Chicago, I love the change of seasons. The fall colors popping out, winter snow, spring blooming, and of course, lots of sunshine in the summer. What I don't love are sinus infections. I don't think anyone does, which can happen typically between the fall and spring seasons. So you know what I'm talking about. This friendly combo of blowing your nose and wiping your nose and maybe some facial pain and pressure, and then occasionally you can have a headache with that too, or a fever. Most of the time it goes away, but sometimes they linger around a little bit longer. So the good news today is on 3 big questions at Rush, we're going to talk to Dr. Peter Papagiannopoulos about what sinus infections are and when the right time is to see a specialist about it. Dr. Papagiannopoulos is an ear, nose, and throat physician at Rush, whose specialty is helping people if they're having difficulty with chronic sinus infections. Welcome, Dr. Papagiannopoulos.
Thanks very much for having me, Dan.
So, question 1 is, how do I even get a sinus infection in the first place?
So the first thing to know is that sinus infections are very common and a part of normal life, frankly. Most of us will get 1 or 2 a year. So there's nothing wrong with you. Just kind of know that to begin with. But what a sinus infection really is, I think it first requires understanding what the sinuses are, or at least having an awareness of what they are and what they do usually, and then you can understand how they can go wrong. So briefly, kind of what the sinuses are is they are air-filled cavities in your face. So we have 1 in each forehead, we have 1 in each cheek, we have a set between the eyes, and then we have a set in the middle of the head, and they all kind of connect with the nasal cavity. And the job of these sinuses really is twofold. First, since they're full of air, they're making your head a little bit lighter. And second, they make mucus, and they make combined, this always shocks people, about 2 liters of mucus a day. And that mucus goes in your nose and it helps clean our nose out. And we kind of all swallow that, kind of throughout the day, usually without thinking about it too much. Now, we can get an infection in these sinus cavities where, as you described very well, essentially you start developing symptoms of congestion, facial pain and pressure, maybe some diminished sense of smell, and often green and yellow drainage from your nose as well, where you're blowing green and yellow out your nose. The reason this happens to folks, really, the most common reason, 99% of sinus infections begin with a virus. So typically, a virus like the flu, COVID, rhinovirus, there's hundreds of viruses that can do this. They cause inflammation in your nose and in your sinuses. This causes those sinuses to get swollen. When they get swollen from this virus, the mucus they produce gets stuck in them. Mucus that's sitting in these spaces, it's an opportunity for bacteria to start growing and cause an infection. So the most common cause of these sinus infections usually is a virus, but there's other potential triggers as well. For some people, it's allergy. So you mentioned the variation based on the time of year. So many folks have allergies in the fall or spring that may trigger infections. And others, and those that sometimes require more intervention, are those that have inflammation in their sinuses all the time, and that's called chronic sinusitis.
So question 2 is, if these most of the time go away, but obviously sometimes they don't, as a first step, is there anything that I can do on my own to sort of help myself get over whatever's going on?
Yeah. So first off, even if it becomes a bacterial infection, know most of the time, even if you did nothing, your body would eventually take care of it. But in general, this is what I would recommend during that first period. So for the first 7 days, you can pretty much presume, even though you're feeling miserable, that it's a virus. So typically what we recommend is you use decongestants in your nose. So that'd be 4 days maximum of a medication called Afrin or oxymetazoline. It is a nasal decongestant spray, and I would use it 2 times a day for 4 days. Then you got to stop because your nose gets addicted to it after 4 days. So that's a very helpful tool, though, in those initial days of feeling like you have a sinus infection. The second thing you do is, once you have things decongested with that Afrin spray, is you want to then help get that mucus out of there. So the best way to do that is by doing saltwater rinses. So people have heard of things like the Neti Pot or Neilmed Squirt Ball or Nuvage. They all work well. Basically, they flush high volume saline through your nasal cavity. It helps flush that kind of mucus out to help you feel better. Number three, some people also feel better if you use oral decongestants. That's like Claritin D or Allegra D. You have to go to the pharmacist and ask for the decongestant version of these medications. And that can help also open the nose up and the sinuses up so they can drain better and you feel better. So in most cases, for those first 7 days, you do these things, you'll feel a lot better.
Okay, now it's time for question number 3. If the symptoms aren't clearing up, at what point should I come and see a doctor about it?
Yeah, so I think that in general, the rule would be, hey, at day 7, if you're not feeling like you're improving, or if within 7 days you started feeling better and then started feeling worse, that's a sign to you that this is transformed from a likely viral process into a bacterial process. So I'd say the magic number is 7. If you're not feeling like you're on the path to being better by day 7, you should see a doctor, whether it be urgent care or your nose and throat doctor or your primary care doctor, to consider starting antibiotics. The second caveat was if you were feeling better after day 3 and then started feeling worse day 5, you can also presume it is a bacterial infection. That's called double worsening. And then an antibiotic would also be indicated in that situation.
Any other tips to keep in mind?
If you're having repeated infections, if you're having more than 3 or 4 sinus infections a year, that may signify that you have chronic inflammation in your sinus cavity. So in those situations, I would just say, come see an ear, nose, and throat doctor. We can help figure out a way to make you feel better.
Well, Dr. Papagiannopoulos, thanks so much.
My privilege.